Hello everyone, welcome to Patho Excellence. In this endometrial pathology video series, in today's topic we will discuss pregnancy related changes, hormonal therapy effect and endometritis. Whenever we see endometrial biopsy, we must need clinical history to rule out any pregnancy related bleeding or if patient is on any hormonal therapy or any cause of infection. So, first of all, what is the normal histological appearance in the endometrium during pregnancy? So, in the first to third week of pregnancy, stroma shows edema and there is progressive decidual changes. Glands are generally hypersecretory with cytoplasmic vacuoles and luminal secretions. There is sawtooth appearance, tortuosity, distended gland and rare area-stilla reaction. Spiral arteries begin to thicken. There is superficial venules are congested and dilated. And during the 4 or more weeks duration of pregnancy, there is marked decidualized change. Glands are now irregular and inactive, variable area stellar reaction, clear cytoplasm, and optically clear nuclei. Spiral arteries are generally thickened and superficial venules are dilated. So here in this section A and B, we can see stromal effect during the pregnancy, and this is the hypersecretory glandular epithelium. So stroma here show abundant pink cytoplasm, clear outline. So this is called decidualization of stroma, dilated and congested vessels. Here we can appreciate glands having multiple infolding of the epithelium, and it is showing pseudopapillary appearance and having secretory activity. So we can appreciate vacuolated cytoplasm and there is decidualized stroma. Now, whenever there is ectopic pregnancy, the endometrium respond to this effect of hormone and it shows features like seen in dysfunctional bleeding, including anovulatory bleeding patterns, irregular secretory patterns, or progestin effects, and focal area select reaction or small aggregate of gland cells with clear cytoplasm can suggest an ectopic pregnancy. So what is area stellar reaction? This is generally seen at the 4 to 8 weeks after blastocyst implantation, and it is a physiologic response to the presence of chorionic tissue either in the uterus or at an ectopic site. So morphologically, this reaction includes nuclear enlargement up to 3 times normal size, nuclear hyperchromasia with abundant vacuolated cytoplasm. Cells are stratified and nuclei show characteristic hobnail shape, which is bulging into the gland lumen, and the large nuclei may contain prominent cytoplasmic invaginations and mitotic figures are rarely present. So there are 2 histologic patterns we can appreciate in area stellar reaction. One is hypersecretory change, second is regenerative change. These both changes are may sometimes present together and they show overlapping features. So hypersecretory, as the name suggests, it is having secretory activity, so clear to foamy cytoplasm, stratified nuclei, and convoluted glands. While regenerative, here the cytoplasmic secretory activity is little, so dense cytoplasm of the glands, and there is hobnailing effect of the cells. So here we can appreciate these 2 effects. First, it is a regenerative pattern. We can appreciate enlarged nuclei, abundant pink cytoplasm which is dense in nature, and this is hobnailing effect. And sometimes we can appreciate cytoplasmic invagination into the nuclei. So this is regenerative pattern. And Hobnaling effect we can appreciate here. It is like a nail top which is protruding from the surface. So this is hypersecretory pattern. As compared to this pattern, this is having vacuolization, enlargement of nuclei, hyperchromasia, along with stratification, secretion, and Hobnaling effect. So this is hypersecretory pattern. This is regenerative pattern. Here we can appreciate a very beautiful Hobnaling effect where the glandular nuclei are protruding into the lumen and they are separated, having the Hobnaling effect. Here the stroma is showing residualized change and some lymphocytic and neutrophilic infiltration is seen. Now hormonal therapy effect. So hormones used in women of reproductive age that clearly have estrogenic or progestinic effect, such as oral contraceptives. Second, estrogen progestin hormone replacement therapy in postmenopausal women. Tamoxifen therapy for breast cancer and some other hormones also show effect on the endometrium. Now, why the biopsies are performed? So here it is for the hormonal effect. If there is present in endometrium, we can appreciate. So first, surveillance during postmenopausal hormonal replacement therapy for the evaluation of abnormal uterine bleeding related to therapy, assessment of treatment in case of hyperplasia or carcinoma, and evaluation of status of the endometrium following hormonal induction of ovulation or endometrial growth in infertility therapy. Now, let's see one by one estrogen and progesterone effect. So, first, estrogenic hormones. It is now rarely used in perimenopausal or postmenopausal women for the treatment of hot flashes, ectopic vaginitis or osteoporosis because it is having a increased risk of endometrial adenocarcinoma associated with unopposed exogenous estrogen. The effect of proliferation in the endometrium is depending on dose and duration of treatment. Changes range from proliferative endometrium with or without breakdown to disorder proliferative endometrium to atypical hyperplasia and adenocarcinoma, and it is also been associated with metaplastic changes. Now, second, progestin and oral contraceptives. So, progestins and oral contraceptives are synthetic forms. They are used for the management of abnormal uterine bleeding, that is progestin only therapy, or it is used as a contraceptive in form of hypodermic implant or intrauterine delivery system to treat endometrial hyperplasia or low-grade carcinoma in patient who wants to preserve their fertility, or as a combination with an estrogen as a contraceptive. This hormone only therapy either in the form of medroxyprogesterone acetate or norethindrone acetate is used. Now, what is the function and what is the role? It suppresses ovulation and endometrial growth and induce secretory maturation and progesterone withdrawal bleeding. So, estrogen, if it is used, we can see in biopsy proliferative glandular changes, while in progesterone, we can see secretory changes. Now, progestin effects are divided into three types: decidual or pregnancy-like effect, secretory effect, or inactive effect. So, decidual or pregnancy-like effect shows abundant tissue and often polypoidal tissue in dilatation and curettage specimen. Glands are predominantly inactive but rarely show marked secretory activity. Stroma appears decellularized with lymphoid infiltrate and vascular ectasia. While in secretory effects, moderate to sparse amount of cytoplasm, mild tortuous secretory glands lined by columnar cells, stromal cells are plump over or showing pre-decidual change. So this is decidual change here, pre-decidual change, vascular ectasia, and inactive effect shows very little amount of tissue. Glands are small and inactive, not coiled. And here the stromal cells are plump to spindle shape in nature. Now, first effect, decidual or pregnancy-like effect. So it is due to high dose progesterone therapy for anovulatory cycles or for endometrial hyperplasia. The sample is here abundant and polypoid in nature. The stromal cells, as we have discussed, it is decellularized with mitotic figure occasionally present, hypersecretory with vacuolated cytoplasm and luminal secretion or sometimes atrophic glands, and area scilla reaction and squamous metaplasia can be seen. Venules can be ectatic and numerous granulocytes in the stroma. So here, this is a beautiful decidualized cells showing clear outline with abundant eosinophilic cytoplasm, round, oval, enlarged nuclei. Glands are here atrophic with little cytoplasm and cuboidal epithelium. Again, decidualized stroma, edema is there, and glands here are having inactive appearance with secretory exhaustion. High power view shows this decidualized cells, clear outline, abundant cytoplasm, centrally placed oval nuclei. Here the dilated gland with cuboidal epithelium and showing vacuolization of the epithelium. And here we can appreciate some signet ring-like cells, and these are the ectatic or dilated vessels. So this is vacuolated cytoplasm pushing nucleus toward the periphery. This is a stromal signet ring appearance, and this is due to progesterone effect, and we can here also appreciate multiple vacuoles in the cytoplasm. So this is signet ring appearance, sometimes can be seen. Again, abundant eosinophilic cytoplasm, peripherally pushing nucleus, and here dilated vessels, atrophic gland, decidualized cells showing vacuolization. So this is a effect of high dose megestrol acetate for breast carcinoma. So second pattern is secretory pattern. Here there is slightly coiled or straight or inactive irregularly distributed glands in the abundant stroma. Basally oriented nuclei is there. Low columnar cell having small amount of pale staining supranuclear cytoplasm. Some cells shows randomly distributed vacuoles. Stroma shows weak pre-decidual change, and they having cytoplasm mildly enlarged, and they are ovoid in nature as compared to large polygonal in the fully decidualized stromal cells. Blood vessels are thinner in ectatic, intraluminal secretion can be seen, and these changes do not correspond to any day of normal cycle. Now, secretory pattern here, we can easily appreciate dilated and tortuous gland showing vacuolated cytoplasm, luminal secretion, so showing secretory activity with decidual-like cells of the stroma. So secretory pattern. Here in high power view, we can appreciate secretory cells, tortuous glands. Stroma shows pre-decellulization, having moderate amount of cytoplasm and oval nucleus with some dilated and ectatic vessels. Here, progesterone effect with secretory pattern, but these glands are underdeveloped, tortuosity is there, but compared to previous slide, we can see here the stroma is increased relative to the normal secretory phase, and we can appreciate some secretion in the gland and pre-decellularized cell having round oval nuclei, plum-shaped cells, and edematous stroma. Here the endometrial glands are having inactive appearance, some of having secretory change, and there is thrombus formation here in the vessel, and this type of thrombi result in bleeding, which frequently leads to biopsy. So these are the underdeveloped secretory glands. Now third pattern is inactive pattern. So here inactive patterns, we can appreciate straight and glands lined by inactive epithelium with basal nuclei and scanty cytoplasm. So sometimes weak secretory change, this can be seen. Stroma appears highly cellular with plump cells or can be edematous or myxoid and mostly having spindling of stromal cells, and ectatic vessels are seen. Here we can appreciate abundant stroma. Glands are due to long-standing progesterone effect shows very small and tiny, and some are indistinct, few showing inactive appearance. So this is inactive pattern due to prolonged progesterone effect. In high power view, we can appreciate some glands show, occasional glands show secretory change in the or secretion in the lumen. This is inactive gland, but the stroma shows spindling effect. So this is a atrophy, or this is a stroma showing a spindling effect. So as compared to deciduli and secretory pattern, here the spindling effect is prominent, and this is due to continuous oral contraceptives. Here in this section, we can see subnuclear vacuolization in most of the glands. This is a case of postmenopausal woman taking estrogen progesterone therapy, and here the appearance is like a secretory endometrium, secretory phase endometrium, and here this is spiral arterioles, edematous stroma we can appreciate. Here, due to prolonged progesterone effect, there is clustering of the stromal cells. These two glands are inactive or atrophic, and this is a case of patient having long-term oral contraceptives. Now another drug is tamoxifen. It is non-steroidal anti-estrogen drug that is used in hormonal therapy for breast carcinoma. This drug is a selective estrogen receptor modulator with its action mediated through the estrogen receptor. So here we can appreciate a polyp due to tamoxifen, and polyp shows irregular staghorn type of shape of glands, shows weak proliferative activity. Stroma is mostly edematous and fibrous in nature. So this is tamoxifen effect on the endometrium whenever given to case of breast carcinoma patient. Now, third topic is endometritis. Endometritis may be due to specific microorganism or non-specific. So, specific may be Neisseria, tuberculosis, chlamydia, or mycoplasma, cytomegalovirus, herpes simplex virus, or any actinomycosis related infection. Some are associated with intrauterine contraceptive device, some granulomatous excluding tuberculosis, postpartum, post-abortal, or pyometra. Now, what are the morphological features for non-specific endometritis? So, in non-specific endometritis or chronic endometritis, plasma cell is must. So, plasma cell infiltrate, if present, then it is a case of endometritis. Increased number of lymphocytes and lymphoid follicles, variable presence of neutrophils in the surface epithelium and glands, reactive stromal response, altered gland development, or breakdown and bleeding. So, these are the features we can appreciate in the non-specific endometritis. Here the section shows stroma and gland is infiltrated by abundant number of polymorphs. So, this is a case of acute endometritis. So, prerequisite for acute endometritis is gland mush infiltrated by polymorph. Because stroma in menstrual phase, normal menstrual phase cycle shows presence of polymorph. So, here we can see glandular cells are also infiltrated by polymorph. This is a case of acute endometritis. Now, in chronic endometritis, presence of plasma cells is the indicator for the endometritis. So, here we can see plenty of plasma cells in the stroma, reactive change in the gland in the form of abundant eosinophilic cytoplasm and enlarged nuclei. So, these are active or reactive epithelial changes with plasma cell infiltrate. Here we can see same in high power view. These are the plasma cells with eccentric nuclei, perinuclear host, and abundant cytoplasm. So, presence of plasma cell indicates chronic endometritis. Here again, this yellow arrowhead shows plenty of plasma cells, some hemosiderin pigment due to internal bleeding or abnormal uterine bleeding as a cause of because of endometritis. This is tuberculous endometritis. Section here shows endometrial glands and stroma, but there are numbers of granuloma formation, well-formed granuloma comprising of Langhans type of giant cells, epithelioid cells, and lymphocytic infiltration. And this is, if we do acid-fast stain, there may be presence of acid-fast bacilli or tuberculous bacilli we can see. So, this is Langhans type of horseshoe shape, appearance of nuclei, Langhans type of giant cells, epithelioid cells. So, granuloma contains 5 components normally, Langhans type of giant cells, lymphocytes, epithelial cells, some of fibroblasts, and if caseation is present, then it is called necrotizing granuloma. This is a case of intrauterine device related endometritis due to actinomyces. Here we can appreciate sulfur granules with clubs. So, these granules, here we can appreciate this cotton wool appearance of this actinomyces. This actinomycotic endometritis, these filamentous organisms are surrounded by chronic inflammation, and this is the special stain, Gomori methenamine silver or GMS stain, strongly decorates such filaments. This is actinomycotic endometritis. postpartum deciduitis. This curated sample shows residual decidual tissue which is infiltrated by abnormal or abundant neutrophilic cells. So this is postpartum deciduitis. So these are the topics like pregnancy-related changes or hormonal therapy effect or endometritis. Whenever we see endometrial biopsy, we have to keep in mind these changes, and we have to take proper clinical history to rule out all these causes. So I hope you like this session, and if you want more such sessions, then please like, share and subscribe this channel. So thank you very much, and stay tuned for next topic, in which we will discuss metaplasia, polyp and hyperplasia. Thank you.